morning. We're letting people in. We will start here in just a second as we're getting everybody let in on this awesome Friday.
The interesting thing with Zoom now is that it's almost like a hospital. There's a waiting room and somebody has the authority to call you in.
That's
and it's
right.
always later than you thought it would be. Those
That's
kind
right.
of things, isn't it, Shawn?
Yeah. We could have a whole thing around that, couldn't we? Awesome. Well, good morning, everybody. Welcome to the Disruptor Connection on Friday, October 9th. Very excited for our guest today. I'll give a formal introduction, but again, we love to pull together big thinking disruptors for some authentic conversations around these cutting edge topics, and Lucien, you are definitely one of them that we are very excited to have with us. So a big shout out to everyone too, if you're watching on Facebook Live. Just remember that this webinar is being recorded and will be available at the conclusion of this event at our Disruptor League YouTube channel. Q&A function, if you have questions for Lucien or myself, I will be monitoring those throughout this 45 minutes. So put those there, not as much in the chat, but in the Q&A section. But we will be monitoring the chat as well. Awesome to start today. What we're going to actually start today with, a little different than we have from some of our other Disruptor Connections, is we're actually going to start with a poll this morning, and then I will give an official introduction. So the question to start today is, what percentage do you believe healthcare could be virtualized? So what percentage do you believe, yourself personally, believe that healthcare could be virtualized? And while you guys are answering that, I am going to officially give a little bit of a background. I met Lucien Engelen. We were trying to think now, Lucien was when we were all at Mars in Canada. So that was in 2014 or 15.
It was 15, I think. Yeah.
15, yeah.
Absolutely. Yep.
Met you through our wonderful friend who did the last Disruptor Connection with us, Zaina. She said, you have to meet this crazy guy, Shawn, from the Netherlands. And heard you talk, Lucien, and have just been so impressed. And then I had the honor to travel to Nijmegen, where at the time, Lucien was leading their innovation work at Radboud, the hospital system, and learned a whole new way of thinking around innovation in healthcare. Since then, Lucien has moved on, doing amazing disruptive things across not only in Europe, but across the globe. And even more exciting, we were able to have Lucien on our podcast, The Combustion Chronicles, which will release next week. So if you don't hear everything you want to hear today from Lucien, you can jump in and download the podcast next week as well. So Lucien, welcome.
Thank you. And you know, in terms of anecdotal, Zaina said to me when I was over at Mars, you have to meet this crazy guy called Shawn. So our sister from another mother knows how to combine and connect people, as we all know, of course.
Yes. And you know, you guys know my colorful hair. Lucien loves my hair. So it is blue, Lucien. I just decided today
it's dark blue right now.
Yes, just decided today to wear the Mophie cap during this.
That's good.
So, Lucien, let's dig into, let's give just a perspective on what you're doing right now, and this whole concept of the intersection of healthcare with the cross intersection of society. What do you mean by that? And what do you mean around this, even this healthcare everywhere concept?
Well, thank you for the question, Shawn. And I think it's both near to both our hearts and minds that we see how extremely important healthcare is. And we also saw we also see how healthcare suffers as we speak, not only during this pandemic, but that was true also prior this before this pandemic had to hit the world. What we've seen is that there's a lot of struggle in terms of burden on healthcare professionals. For instance, with administrative burden, like 40%. We see doubling in healthcare demands coming up. We see pressure in terms of shortage of skilled personnel. For instance, in the Netherlands, we're 40,000 nurses short a year, just to give you one number on that. And on the other hand, we also see that patients, family, and informal care have the ability, with, for instance, the use of good technology, to have a different model. That's one end. The budgets and the costs, or total costs of healthcare, are surging through the roof. And on the other hand, we also see that a lot of the things that we try to fix in healthcare could be prevented. So that's the preventional aspect of that. And what I think, and that's one of my theses that I'm working on right now almost every day, is that what if we start using other players in society to help increase the notion of prevention and also to utilize that? What if we could create collaborations with supermarkets or with financial institutions, because we know that people who have a high financial debt also use more healthcare in total sense, for instance. So I think that in the intersection of a lot of industries, we really could pay more and better service to create a more sustainable healthcare system that also increases the, let's say, the experience or more the convenience for people that they get their healthcare delivered by.
Yeah, so let's go back to what you just said, Lucien. You said, you guys are facing a shortage of nurses of 40,000. That's amazing. So what I find interesting is this gap between this shortage that we're talking about in healthcare workers, but yet, and this was in 2019, September, so a year ago, the Health Resources and Service Administration here in the United States actually said that we're going to have an excess supply of almost 300,000 nurses by 2030. So here we have this, you're facing a shortage, and we're saying that by, the next 10 years, we're going to have this excess. It does just bring to light this whole concept of, I don't even know what we really know and don't know in healthcare, right?
Yeah. You know, the interesting thing about that, Shawn, is this comes with waves. And whether or not those waves will be 7 years. 7 years ago, we indeed had a excess of nurses, for instance. And then people said, stop training nurses. And now here we are. And the same is true with educators and other professions. So it looks almost that, like, not only from a political standpoint of view, we see these waves coming up back and forth. So I think that's one end of it. Second of all, it would be very understandable to try to exchange people from the US to the Netherlands or the other way around. But let's also be honest, we face language barrier, we face even cultural barriers, stuff like that. So that's not going to work. The thing, however, is that I think that the solution for many of the problems that we face in healthcare, that the solution for that is health. So if we improve the health of our citizens, we can prevent stuff that we're now fixing at the end of it, and also for way higher costs than what we would have if we would try to prevent things from happening.
Yeah, and Lucien, I will say I appreciate that. That's something I learned. We talk about wellness or well-being here in the States, but I never really had a full concept of how you do that in a community, how you do that in a city, until I did come and visit you and was part of the group that came tonight, Megan, to understand how that preventative piece, and we're going to talk about some of that here in a minute. I don't want to lose sight of the poll, so I would love to see of what people think. So 50%, really 95% of people think that we can do a ton around healthcare could be virtualized. So 50 to 75%, 45% said that. What's your thoughts around that, Lucien? Because I know you have some big thoughts around how we could virtualize healthcare.
Well, I think Cody, who mentioned this also in the chat, is right. It also depends on the definition of virtualization, of course. But it's more like let's be honest, what happened during this COVID pandemic. I've stated in an interview for a Dutch newspaper, I said, we were pregnant for digital health for years, and it came to life with a C-section during this COVID pandemic. All of a sudden we had to. There was no alternative than to have video consultations and remote monitoring with our patients because they could not come to our locations. And now you see that that has brought also a boost into the utilization of it. Some people will roll back, others will not. But the interesting thing is that if we start doing that and asking patients what they prefer to do, it gives a totally different mindset. And the technology has been there already. I was one of the two people in the Netherlands that back in 2014, so that was a year prior that we met at in Toronto at Mars, to help change the legislation in the Netherlands to get video consultations reimbursed and certificated. So that's 2014. And still it's in the realm of 10, maybe 15%, and maybe even lower today. And so I think this boost that has been given throughout this pandemic does help. The other thing is also that we need to see and get evidence-based modalities, of course, into that, and that always takes us a while. Let's be honest. If you run your PhD thesis, it's like in the 4 or 5 year realm that we're looking into it. And the third thing is that patients has been up until now reluctant to say, if the doctor says I had to come, I'll go to the hospital. And now the genie is out of the bottle. So what you see now is that patients that are urging, just like they're doing that in their supermarket or with their travel or with their banking, that they say, why do I have to take a day off from my work, burn fossil fuels to go to that hospital, find that last parking spot at the way end of that upper deck at the hospital for my 10 a.m. appointment. I rush to the front desk. I'm exhausted at 2 minutes prior to 10 at the front desk. And somebody would say, please take a seat because he's running late. That's the reality. Makes no sense for the 10-minute visit that everybody runs into it. And sure enough, that's not applicable for every condition that you run into, for instance. But that's also something that we have learned now during this pandemic, is that we have a more clearer view of the things that digital health are beneficial for and those that are not. But now we have a debate that's fueled by experience as opposed to assumptions that we already had.
Yeah, it's interesting, Lucien, and you know that I have a son who's on the spectrum, and you know, when they said to us and said to my wife, you know, we really would like to start doing his therapy sessions via televisits, right? She was like, I just don't know. I don't know how he's going to do with it. And everything you just laid out was everything she experienced, you know, trying to get him into the so by the time they would get to the visit, he sometimes would be so irritated, exactly, that he didn't get anything out of the therapy, where now today he sits at his dining room, our dining room table, can have some of his toys that he's used to playing with, and is excelling in this whole concept of therapy online, which people were so reluctant to before March, right? And now we're being forced to do it.
Well, that's the thing. Now we've experienced this, and prior to that, we were thinking about it and we were assuming things. And that's why I also, during my tenure at Radboud University Medical Center, in the Reshape Center that we've created, we said, we no longer take assumptions. We'll try it, we'll break it, or in your way, in your words, we blow shit up, just to take one approach for that. And that does work. But the thing is that it's not failure if it doesn't work. That's good, because we've learned from that, and from that we'll take it into the next step.
Yeah, I love our sister from another mother, Zaina's comment said, can you imagine the artwork that would accompany an article with the title, and I had typed in there,
Let's not go there.
Caused us to have a C-section. So I love that. I had to write that in there, Lucien, because pregnant with digital health, and now the pandemic caused us to have a C-section.
Let's be honest, we had to do it almost instantaneously. Big hospitals in a weekend completely turned around their whole system of their outpatient clinics, apart from all the other hassle that we have, of course.
Yeah. No, I love it. So let's talk about your thoughts to Lucien, around impact on healthcare insurance organizations on the future. So, you know, I can only imagine from your perspective what your thoughts are on insurance. And we all have lots of thoughts here in the States around insurance. So,
Yeah. So
yeah.
let's not dive into the political discussions or debates on that. We have different systems. You know, we have different systems between the US and the Netherlands. We have totally different systems. But in general, my thoughts about healthcare insurance are the following. Many of the things we do in our daily life are based on loyalty. The majority of the people shop at the same shopping center and get their groceries at the same place, have the same bank, these kind of things. What you see now is that healthcare insurance, at least now, brings this vast majority, which is a total package that everybody in the Netherlands get reimbursed, as opposed to how the system in the US works, for instance. What I think that is going to happen over the course of the next decade, not earlier and also not later, is that other organizations will start to deliver premium packages to get healthcare delivery mainly in a digital format. Because due to the fact that a lot of also healthcare insurance organizations, and not all of them, they're very good examples, and luckily many of them are in the Netherlands, but are reluctant to using these kind of digital interventions, others will embark on that. Just imagine for a minute, and let's not again use Walmart because you and I are totally aware of what's happened there, but just imagine that Amazon, with their installed base of Prime members, would add like 10 to 15 bucks to their Amazon Prime membership and would say the majority of the digital interventions that are regular and very easy stuff, including medication and drug delivery, would be done through an Amazon Prime membership, and they would add that to all their Amazon Prime members. Just think about a minute about the amount of cash that would be involved in that and what they could buy from that. So I think in the end of the day, and this is just one example, I could give the same example with Apple, for instance, to say, hey guys, you can get an additional healthcare insurance package that gives you an Apple Watch, that gives you an iPad, that gives you all kinds of other stuff. And the information out of that through Apple's Health Kit, and by the way, I don't own any shares of Apple, just to be frank in that, goes through Apple's health app into the systems of the hospital. And then people would say, no, that's not possible. But this week, the NHS Oxford University Hospital announced that all the medical records of the patients will be available, are available already in Apple's health app. So now back to the insurance package. I think the access will be through the health arena, lifestyle related stuff, then bringing in insurance packages as a premium additionally to that what's happening. And yes, of course, Shawn, that maybe is not accessible for each and everyone, certainly not with people with lower income. But guess what? I think a lot of us paid the early iPhones and the early smartphones for big cash. And with that money, the innovation trickled down. And now in the Netherlands, in the Netherlands, the average Dutch citizen owns 1.3 smartphone. So we came from far, and now it trickled down to everybody in society. Same happened with the internet. First of all, for the people with big money. Same happened with TV sets. Same happened with radio. That's how things in terms of innovation work in society and have been working in history.
Yeah, you picked your phone up as mine's sitting right here too. You know, I've already got, next week the new one's supposed to be out. I'm like, got it on the thing. And Dana, I love that you just wrote because the UAE, the average person owns 3 smartphones. So I love that statistic. 1.3 smartphones. I haven't figured out how to get a 0.3 of this.
The 1.3 is that they had it's a combination of your personal iPhone and the phone for your business.
Yeah,
of course.
So I wrote a mind blown comment you made there around the NHS doing the connection with the the watch, and now you can own it. That still seems so far away for us here in the United States to where we own that we have access to our own data, because the system's not been set up this way. But I try to tell everyone, and Zaina talking about the UAE. I know Lucien, you do tons of work there. I've been over there to Dubai. Like, they own their data,
Yeah.
they own it, they control it. Why in your opinion do we make it so complicated here in the United States?
Well, first of all, I think, by the way, there is small pockets in the US also where it is possible. Cedars-Sinai, for instance, also has the connection to Apple's HealthKit. So if you're a member or a patient over there, it does work. I think it has to do with culture, for one, but also with how legislation has been built. I was in a debate yesterday in a round table, and one of the things I said in an answer to people said, how could we control the data? And I said, I think we have to change the Constitution, actually, for that. In the Constitution, in the end of the day, should state that the data is yours, not only to see, but also to own and to take. If that is the case, then all of a sudden these things will change. And of course, that's not going to happen in a fortnight. We all know that will take generations, maybe even. But the good news is that I see these developments over and over also happening in society and across the world in different flocks. And I get asked a lot, which country in the world does it the best? And I think Cody just mentioned Estonia, Estonia, where indeed a lot is happening, but they get their challenges as well. I don't think that there's any one country in the world that is doing it the best. The problem is that Estonia is doing some things very good. In Alicante, in Spain, for elderly people, they rock the boat totally, and everybody goes to the United States or to other places. Go to Alicante in Spain, and they've been working for 15 years already on these kind of aspects. So what would happen if we could combine those things, if we could learn from each other, and if we don't try to invent and reinvent everything over and over again?
I love that idea. And, part of what we're doing in the Disruptor League, we're stealing from work that you did, Lucien and Zaina did around, the Health Innovation School and what we're calling the Health Innovation Living Lab. Wouldn't it be great if we could get all these systems to come together and do a project to say, hey, let's take the best of all of those globally, and let's go figure out what it should be. So just putting that out in the airwaves. Let me share. Maybe we need to do that.
Let me share a slide briefly with you, Shawn. Awesome. Is this up at your end?
Yeah.
Okay. Yeah. So this is research that I helped Deloitte been doing, which has been published 2 weeks ago. An interview and review in 1,800 people in healthcare across Europe. The question here is, what 3 actions in order of priority should organizations do to improve the pace of healthcare? So the top 3 is obvious, but I really want to emphasize on the 4th one. Why don't we adopt technology that already somewhere has been proven and just not go over and over again to iterate and to get the money up and running and stuff like that? Because it does not make sense to do these things over and over again. Why not learn from each other and do these things together? And I think it's insane that insurance organizations in the Netherlands are paying for exactly the same pilots as that are running in Canada or running in Sweden or even in Estonia, for instance. We're global citizens, and I understand the burdens and the hurdles for it, but I also don't see real traction on that aspect, unfortunately.
Yeah, and I think, we've talked about this over the past 7 months, right? The one thing the pandemic has done has brought us back to a very global concept, right? We have all lived very fast-paced, separate lives in our own countries and our own continents. And I think we are at a prime time. Lucien Shawn Savinsky, which we've talked about, and the work that he did at Walmart, that's what he's wanting to do. He's like, we need to learn from every organization, every country. Let's bring it together. So now it's time for some of us crazy people to make that happen. The other thing there's 2 more things I want to talk to you about, because one of the things and we talk about this some in the podcast, Lucien, is the journey of a life of a patient and your whole concept of patients included and all that stuff. So let's talk about that before we dive into the last topic here. But yeah, like
that's good. Well, again, let me share some briefly some slides. Starting with this one, and just for our great people out there, this is not a misrepresented flag of Japan. Some people could think that it's the wrong one, but this is the red dot represents the 1 hour that a patient living with a chronic condition visits his or her specialist in a year. And the other 8,765 hours, they're on their own. And this is work from my great friend Sarah Rigare from Sweden. And one of the other things that I've tried to do is that we always talk about these patient journeys, right? But the reality is it's not a patient journey. It's often a journey in one hospital, in one system. And also in that hospital, only on one ward, for instance, and mainly also with one physician or one professional. And Annemiek Vroom from Foundation Icone came into my office when I was doodling this slide, and she nodded her head and said, "You really don't get it, isn't it?" I said, "What's wrong with the slide?" And she said, "You are forgetting the most important part of that, which is the journey of my life. The majority of the choices that I make as a patient, been in healthcare for all of our life, is based on the journey in their life." So I think that's a very important notion that we have to embark on. And once you get that, you also start to loop in patients. And when I say patients, I talk about patients, family, and informal care. It's the triage that you need to loop them in each and every phase of everything that you do. And not like and say, hey, let's bring in patients. You know, back in the early days of the Western movement, Shawn, when there was not an Indian, the editor would say, "Go get an Indian," because otherwise it wouldn't be a Western movie. And that's the same that is happening a lot in healthcare systems now. Bring in patients so we can check mark that we've consulted patients. But the real action is start with patients, family, and informal care from the get-go with a white sheet of paper, a blank sheet of paper, and really start digging into together, because it's a joint journey.
Yeah, love it. And, you know, I know that we have very kindred spirits here on this session with us. And I know Sean Savinsky challenges everyone as we go into our new things, patient included everywhere, not just to do a checkbox, right? So yeah. I love the whole concept of the journey of life. So let's talk about your thoughts now, Lucien, around food as medicine.
I like food. We like food.
I love food, but I don't always know that. I had a pretty stressful week. If you could have saw what I had last night for dinner, I would not say that it was medicine. It might have been medicine to the soul, but I don't know that it was medicine for my body. So, you know, some concepts around, you know, prescription-based food, diet, or direct collaboration with food sources. Where's your mind in that space today?
So I think there's so much happening in that sphere right now. To give you one example, and maybe I'll put up one slide on that as well. Maybe that's good because it shows what's possible already nowadays. So we can take a stool sample, and you could send it into a company like this one that is called Viome from our great friend Naveen Jain. And with it, they will process that and send back to you the results that you can see in this one. These are, by the way, my own personal results. And at the left-hand side, you can see, based on my gut biome, my microbiome, what food I should avoid. In the middle section, you can see what are my superfoods. And I'm still very happy that my mother never knew that Brussels sprouts were very beneficial to me. And on the other one, you can also see how you can need what needs improvement from. So in terms of food, we're now heading for the new era where, based on intermediate steps, again, this is not totally for a longer period, but with intermediate steps, you're able to figure out what really does work for you and what doesn't, and change your diet based on that. That's one. Second of all, I think if the cross collaboration starts, for instance, with supermarkets combined with prescriptions from the hospital, nurse, dietitian, or physician, you also could imagine that, and this is where my head sometimes is going berserk, that I think, what would happen if I would go to the grocery store or to the supermarket, and the food that I should take on all of a sudden becomes, like, let's say 10% cheaper, and the ones that I should avoid, all of a sudden, if I enter the shop, in my shopping cart gets a plus price of also 10%. Just imagine what would happen with that, for instance. And I think that really is possible with all the loyalty programs. The key to that is that patients would start to share their information also for that. And with all the privacy discussions and the ethical discussions that we can talk about that, just think for a minute what the impact of that could be in terms of keeping your lifestyle as healthy as possible, if you want that to be. Because there's always that choice. It's not a mandatory kind of thing, but it's more like that. Of course, there's tons of discussions and debates that we need to have about that. But again, I think the cross-section between food and health and healthcare hasn't been explored enough. Let's take one other example. I've worked a lot with young patients with cancer, the AYAs and the adolescent young adults. One of the things that we've witnessed is that when we bring them in for a chemo round, we treat them very well and they get very good nutrition, and we have a nutritionist at their bed and stuff like that. But prior to that and after the chemo round, you're on your own. So why not start treating you with better food prior to a chemo round than after? Because we already know that that is beneficial for the efficacy of those chemo rounds. So why not create a partnership between your grocery store, your oncologist, and yourself, for instance, and maybe even your family, you know? And what would happen if you would come back from a surgery, and in the comfort of your own home, food that's specifically tailored on that, what is good for you at that moment in time, will be delivered, for instance. That still has not been done well. All of the rest of the things in our daily life already are tailor-made to our own systems, so to speak. So I think it's early work, but that a lot of these things are happening already.
Yeah, and we had a question around how ready is society for this food as medicine, and it's the same concept. You know, Cleveland Clinic, Lucien has launched the whole functional medicine, and we've got a podcast coming up with Dr. Will Cole, who is one of the leading experts in functional medicine. Do you see that as a growing industry right now and as a growing way?
Absolutely.
And do you think society is really ready for that?
Yeah. So I think, yes, I think it's a growing industry. And no, I don't think society is ready for that, because society as a whole is not ready for it. You still have to explain if somebody comes at your dinner table and have to adapt to whether they're vegan or these kind of aspects. That still is, it's becoming mainstream, but that's not that let's say 10 years ago, that wasn't. So we're on that trajectory. That's one. Second of all, I also think that we have to look into how we produce our food. And that also comes to other aspects in sustainability as well, of course. And thirdly, I also think, and let's scroll back a bit, like I think for 1,000 years ago, the physician of the Chinese emperor got paid for each and every day that the emperor was not sick. As opposed to what we do now, we pay you when I'm sick to fix stuff. So it's a mindset, it's a mind shift that we really have to embark on. And I don't think that society is ready for it as a whole, but there's pockets of that. There's more and more communities working on that. So in terms of me thinking that is the trajectory that we should head on, I'm very hopeful.
Yeah, and I think you and I put, flip the payment model, pay MDs for the days I am not sick.
Imagine how that would blow the whole system up.
Yeah, that really even changes this, that throws value-based care out the door, right? It's not only am I happy, but I need to be happy and well before you get paid. And that's, we had another question around, and to be more specific, is the medical world ready for this? I think you're answering some of it here. I don't know that the medical world, is really ready for this.
Again, I think in pockets. I had a webinar yesterday with 30, 35 physicians, and we talked about prevention, and a couple of them said, wait a minute, that's not our role. That's not the role of the hospital to take care of prevention. Our role is to be damn good at fixing stuff once things have occurred. Everybody should have his own role. And if this is, for instance, the role of the general practitioner or the family doctor or another one, that's fine. But we should concentrate on where we were trained for. And yes, we understand that we also have to do our 2 cents in terms of prevention. For instance, for bariatric surgery, to name one where you could start working on lifestyle prior to book that appointment for surgery. But there's also something truth in that to say, what is your role now and would you keep it? With the notion of doubling on healthcare demand, Shawn, in a shortaged personnel window already, isn't it?
Yeah, and I want to go back to, and I'm keeping up with, some of the chats, and the whole concept. Zaina talked about in here, shifting from shifting from healthcare to life care. Yep. And then specifically, we all have, all of us have studied human-centered design in some place, but moving to life-centered design, which I love that whole thing. What do you see, as we're getting close to the end, in the next 3 years, Lucien, how do you see that concept of life-centered design and life care? Where do you see the biggest growth markets in that right now?
Wow. That's a good one. I think virtualization is one, combined with what I like to call the delocalization of healthcare. Everything is tied to a location now, and with all the technology that gets smaller and smaller, and I think in 2012 we're talking about wearables and stuff like that, and in 2012 I coined insidables, as in that's the next step. So that also gives her the opportunity to do a lot of things prior to the moment that you've been diagnosed, for instance, even. So early warning systems to get these things up and running. That's an area where I think over the course of the next 5 to 10 years, there will be huge progress. The Max Planck Institute, for instance, has now created nano robots that would travel your veins to deliver specific drugs at a specific place where they can steer those robots to. Just imagine what that would mean in terms of invasive surgery and stuff like that. So I think delocalization in the broader sense, delocalization of the location where healthcare has been delivered, as in the institution, delocalization as in how we get treatments on a specific place in your body, and also delocalization of when will you be diagnosed, where now you can be diagnosed with a watch on your wrist, for instance, or a small RFID chip in the palm of your hand, just to mention one. And the second part where I think will be very much growth, and that's a passion of you and me together as well, is what I like to call, and I'm writing an essay about that, and I named that the retailization of healthcare, where the more consumeristic approach of delivering low-end care that has nothing to do with the specific location where the professional is, and also could be done virtual, really would kick in.
Love it, love it. So one last question here, Lucien. What do you think are the main bottlenecks in the healthcare ecosystem today?
Culture. Culture, bluntly culture. It's not about, we kind of try to escape to say, well, it's about finance, or no, it's about legislation. The reality, it's not. It's about us. We've been trained to do things leftwise, and now all of a sudden we need to go rightwise, for instance, and that's not something that we want to do. We're not ready to give up the place that we've conquered or have been giving to, even though we do underestimate the impact of the fact that this doubling on healthcare demand in a shortage budget with a shortage of skilled personnel is facing us. One of the discussions that I had at one moment in time with an internist, I said, who kind of challenged this assumption, I said, did you run your patient clinic today? He said, yes. I said, was it busy? Yes, it was. How many patients? 12. Just imagine if you would have 24 with 3 colleagues less. That's a no-go area, he said. That's 2030. So if you don't understand or are willing to buy into that notion, as we now also see with Corona, for instance, then this is a hard discussion. And to me, it's more about culture and being able to change than it's about legislation or finance.
Love it, love it. Well, Lucien, we could talk forever on this. I want to thank you so much for your insights, and most importantly, I'm really looking forward to getting over there to visit you and talk more about this retailization. As you know, I've lived a lot of it the last 2 years. Just a reminder to everyone on here, our next episode is the science of saving lives and rethinking the nonprofit world with Paula Schneider, who is the CEO of the Susan G. Komen Foundation. Just actually had lunch with her a couple weeks ago in California. I'm really, really excited to have her join us as well. And that will be 2 weeks from today. And the next week, just if you're interested, Undivided, Getting Real About Diversity and Inclusion. We're doing a virtual unconference experience and to talk about how we are looking at diversity and inclusion across the world and the global world. So very excited for all of this. Again, Lucien, thank you so much for closing your day out there in the Netherlands with us, and we'll be talking to you soon. And thank you, everybody, for joining.
Thank you, and have a great weekend later on. Thanks. Bye-bye.
All right, bye.